Hello, and welcome to Q Biologics webinar, a study of QBECO for remission in people with Crohn's disease. Today, we'll be looking at trial sites and participation details. For those of you who have just joined us, we'll be looking at trial sites and participation details. First, a bit of housekeeping. Everyone except the presenter and the organizer will be muted during the webinar. This will help eliminate background noise and audio feedback interference. Questions can be sent via live chat. The chat can be opened by clicking on the chat vignette on your screen. We will aim to answer all your questions after the presentation is finished. A reminder to people who are phoning in from a telephone line, please also sign into your computer or tablet if you want to follow along with the visual presentation. If you cannot hear the speaker, see the slides, use the chat, or get completely disconnected, please don't panic. The presentation will be recorded and made public on our website. Our web address is QIBD.com, spelled QUIBD.com. You'll also be able to find more resources and any future events will be listed there. Don't forget to like us on Facebook, QIBD, and follow us on Twitter at Crohn's Trial. And now the reason you are all here. The future of medicine lies in treatments that restore our body's innate capacity to heal. That's a quote from our presenter, Dr. Hal Gunn. Dr. Gunn, the founder and CEO of Q Biologics, is a physician entrepreneur who has had a lifelong interest in the body's ability to heal and has dedicated his professional life to understanding how to optimally support the body's immune response to chronic disease. Dr. Gunn is recognized both nationally and internationally as a leader in the field of supportive cancer care, and in 2009 was awarded the $250,000 Dr. Rogers Prize for Vision, Leadership, and Integrity in the field of integrative medicine. Dr. Gunn obtained his Doctorate of Medicine from the University of British Columbia, UBC, and remains a clinical assistant professor at UBC's School of Medicine. In 1997, Dr. Gunn co-founded Inspire Health, Canada's foremost supportive cancer care centre, which supports the health, healing, and immune system function of people undergoing cancer treatment and their families. Under Dr. Gunn's leadership, Inspire Health grew to become a world leader in supportive cancer care with 3 centers, Victoria, Vancouver, and Kelowna, treating 2,500 new patients per year. Dr. Gunn founded Q Biologics in 2007. Without further ado, Dr. Hal Gunn.
Thank you, Bonnie. We'll be discussing our upcoming study of QBECO for remission in people with Crohn's disease and the trial site and participation details. So thank you for joining us. There are 5 things that we'll be discussing in today's webinar: who we are, what is QBECO SSI, the study details, study activities and important dates, participation requirements, and then I'll look forward to answering any questions that you might have, and we'll make sure we leave sufficient time to answer those questions. So first of all, Q is a private biotech company based in Burnaby. We just moved to larger offices and labs from Vancouver to the suburbs of Burnaby. And we've completed 3 clinical trials in Crohn's disease, ulcerative colitis, and lung cancer, and we'll show you some of the compelling results in our Crohn's disease study. Second of all, QBECO SSI. QBECO derives its name from Q Biologics, which is the QB, and the echo comes from E. coli. QBECO is derived from inactivated E. coli bacteria. E. coli is a common pathogen in the GI tract, and QBECO is derived from inactivated E. coli bacteria. It stimulates an innate immune response in the GI tract, which is the targeted organ. It's not a live bacteria. It's inactivated, so it can't cause an infection. But it stimulates an innate immune response in the organ, the gastrointestinal tract, where E. coli typically causes infection. It's self-administered by subcutaneous injection. Subcutaneous injection is a very simple injection like an insulin injection. So technically it's very similar to an insulin injection like diabetics give themselves on a regular basis. I was also co-founder of Inspire Health along with Dr. Roger Rogers, and then 10 years ago founded Q Biologics. And it was in my clinical practice at Inspire Health that I discovered that this site-specific response that occurs to bacterial infection, and recognized that response also occurs to inactivated bacteria. So we can take the components of the bacteria that create that response. Because it's inactivated, it doesn't cause infection. We inject it just under the skin, and we get a targeted innate immune response in the organ or tissue in which that bacteria typically causes infection. Interestingly, in Crohn's disease, what we know is that the innate immune response isn't functioning optimally. There's a suppressed innate immune response. And this suppressed innate immune response can then lead to what's called dysbiosis, or chronic infection with a wide variety of bacterial pathogens. When we treat with QBECO, it's designed to restore innate immune function in the GI tract. But because the innate immune response isn't specific to a specific bacteria, even though QBECO is made from E. coli, the innate immune response that occurs when we treat with E. coli can clear a wide range of bacterial pathogens, not just E. coli, but numerous different bacterial pathogens. And in doing so, we think that we can clear the underlying trigger for Crohn's disease and the overreactive adaptive immune response that occurs in the disease. Here are the results from our phase 2 clinical study in Crohn's disease. It was a 68-patient study. 34 patients were randomized to placebo, and 34 patients were randomized to QBECO. On the vertical axis here is the drop or decrease in Crohn's disease activity index, or the clinical symptoms of people with Crohn's disease. And you can see that in comparison to placebo, there was a much greater drop in Crohn's disease activity index in patients treated with QBECO through to week 8. And that decrease continued patients' symptoms continued to improve right through to week 16. So in this coming study, we're going to be treating for 52 weeks, and we're going to be treating initially looking at endoscopic healing and clinical response at week 16 and week 26. With respect to safety, QBECO was well tolerated. There were no dose-limiting toxicities in the doses we've used in the studies. 95% of all reported adverse events were mild or moderate, and the most frequently reported adverse events were injection site reactions, and that was some mild swelling or tenderness at the injection site. If that occurred, we simply reduced the dose of QBECO, so that didn't happen anymore. Some patients had mild flu-like symptoms for the first few days after starting treatment, similar what you might get if you have a vaccination, for example, but those flu-like symptoms dissipated after a few days or a week. Some patients reported transient fever lasting 12 to 24 hours on one occasion, and sometimes a couple of occasions. We think that may occur when the innate immune system begins working again and begins clearing bacterial infection. Those fevers were transient and weren't associated with any other significant problem. There was also mild nausea and mild fatigue in as a minority of patients initially upon starting treatment. But those were mild symptoms in the large majority of instances. The objective of our coming study is to evaluate the effect of QBECO SSI on endoscopic healing and remission. So the endoscopic technique is colonoscopy, so we'll be looking at the colon and the distal part of the small bowel, the ileum, and looking at baseline to see the activity of the disease before treatment, and then looking again at week 16, week 26, and week 52. We'll also be assessing clinical remission based on symptoms of abdominal pain and soft stool frequency, and we'll also be looking at safety and tolerability, and to confirm the safety and tolerability we found in our last study. The study design, the coming study is in 2 stages. The first stage, which I described previously, is the first 20 patients, and it's an open label study, meaning that all 20 patients will receive QBECO treatment, and as long as people are responding, they'll receive it for 52 weeks. The second stage is 150 patients, and that will be a randomized controlled trial comparing patients randomized to QBECO versus patients randomized to placebo. In that second part of the study, those 150 patients will be randomized on a 2-to-1 basis, so 2/3 of patients will receive QBECO and 1/3 will receive placebo. But for the first 20 patients to join the study, all 20 patients will be treated with QBECO for the full 52 weeks as long as they're responding to medication. The distinction between the first 2 stages of this coming study is the first stage, 20 patients, and everybody will be on QBECO, but there'll be 3 colonoscopy time points. That's screening, week 16, week 26, and week 52. In the second stage, there'll be 150 patients randomized to either QBECO or placebo, but there'll be 3 endoscopies or colonoscopies at screening and at that initial time point, either week 16 or week 26, and week 52. The first stage of the study will inform whether week 16 or week 26 is the best time point to assess mucosal healing. And it's that time point that then will be included in that larger 150 patient study. So we're doing that first 20 patients in order to determine what the optimal initial endpoint is for mucosal healing. With respect to study sites, there have been 4 study sites that are confirmed, one in Vancouver, and that site will be starting very shortly, possibly as early as next week, a second site in New Westminster, which is a suburb of Vancouver, a third in Vernon, which is in the interior of British Columbia, and a fourth in Hamilton at McMaster University. We're also discussing the possibility of and exploring a site in Alberta, and also a site in Nova Scotia. The stage 1 schedule of activities involves 10 in-person and 3 remote visits. And the schedule of those activities are listed on this slide. So there are 3 visits in the first week in person, and then a in-person visit at week 4, week 8, and week 16. A remote visit by telephone at week 24. Another in-person visit at week 26. A remote visit at week 32. And then 2 more in-person visits at week 40 and week 52, and a final remote visit at week 56. During the study, study participants will be asked to complete a study journal where they'll keep track of their symptoms and drug injections, etc. During the stage 1 study, samples will be collected and analyzed for immunological biomarkers, stool and urine analysis, fecal calprotectin, which is measured in the stool, and it's a inflammation biomarker, C-reactive protein, which is also an inflammation biomarker but is measured in the blood, microbiome analysis, which is done on the stool, histology from the biopsies that occur during the colonoscopies, physical examination, a genetics sub-study, and a what's called an in vitro stimulation study. So we'll be taking patients' blood and we'll be looking in the lab to see how much innate immune suppression there is in that blood sample, and looking to see if that changes over time with QBECO treatment. Interestingly, during our last study, we found a correlation between genetics and response to QBECO, and we'll be looking to see if we can confirm that relationship in the next study. So we'll be looking at specific genes that we think are correlated with QBECO treatment and doing genetic testing that will be done from a blood sample. The administration of QBECO in the first stage, that 20-patient study, there'll be no placebo. Everybody will get QBECO. The treatment is self-administered. It's a very small dose, 0.1 ml, every second day. So every second day, people will give themselves a self-injection just underneath the skin. And that occurs somewhere in the abdomen or in the left or right upper thigh area. The needle is very tiny. It's much smaller than as indicated in this diagram here. It's a very, very tiny needle, a 30-gauge needle, which is very small. And in terms of eligibility criteria, the major criteria, although the full list is longer than this, the major eligibility criteria: you have to be at least 18 years old. You have to have had Crohn's disease diagnosed for at least 3 months. You have to have moderate to severe disease as defined by colonoscopy and clinical symptoms. And you have to be willing to follow contraceptive guidelines. We have no reason to believe that QBECO might have a negative impact on pregnancy, but because it's an experimental drug, we don't want to take any risk of that, and therefore, if you're of childbearing age, you have to follow contraceptive guidelines during the study. You're not eligible for the study if you've had a biological therapy such as Humira and Remicade in the last 60 days prior to the start of study treatment. There are other medications like Imuran or prednisone or Pentasa that you can take during the study treatment, but drugs like Remicade or Humira you can't take while in the study. And you must not have scheduled a surgical intervention or anticipate requiring major surgery in the 52 weeks of the study. And you can't be experiencing an active infection. The next steps, if you're interested in the study, are to find out if you're eligible and to fill out the pre-screening questionnaire that's available on our website. Is it available now, Bonnie?
It will shortly be available. It's still being reviewed by the Ethics Board at the moment, and we expect approval in the next 5 to 7 days.
Great. Thank you. So if you would like to learn more about the study before that questionnaire is up and running, please email us at info@qbiologics.com. Otherwise, if you could wait a week and go to our website and fill in the pre-screening questionnaire, that will then bring you through to the next steps towards screening for the study. Oh, and Bonnie's got that information up here. So if you'd like additional information, please contact us at info@qibd.com. And you can also follow us on Facebook and Twitter. And now we're into the question and answer section of the webinar. So please feel free to send your questions, and myself and Jim Pankovich, our VP of Clinical Operations and Drug Development, who's with me now, will answer those questions. So Bonnie will forward those questions to us, and we can respond. So Jim, whenever you have a question, please let us know.
Sure. Thanks. So the first question coming through is with regard to the establishment of a clinical trial site in Alberta and the timeline for that.
So Jim, you might be the best person to answer that.
So a clinical trial site in Alberta is actually on our list, and we've got investigators evaluating the study right now. We did have 2 clinical trial sites in Alberta, one in Edmonton and one in Calgary for our previous trial, and we anticipate having at least one. I couldn't tell you right now the exact time frame of them getting started, but if you go through the process, as Hal said, and if you're interested, complete the questionnaire when it's available in about a week's time, someone will follow up with you, be able to give you additional information when they'll be up and running.
I also have people that I've spoken with already about the trial, and as soon as there is additional information about the timing of the trial sites, I will be calling those people on the list. And as I mentioned, we anticipate the Vancouver site to be operational very shortly, so I'll be calling everybody in the Vancouver area who's on my list. I'll be calling them shortly as well.
And as additional clinical trial sites become available, that information will actually be on the QIBD website. And if you've filled out the questionnaire, you'll be followed up with. So the second question is with regard to if the QBECO, if you participate in the trial and it works for you, will you be able to take it later if your Crohn's disease comes back?
That is a really great question. So Jim and I had been talking about the possibility of submitting a clinical trial application specifically for that purpose. We appreciate very much the participation of people in our trial. I've been contacted now that our next trial has started by a number of people from our last trial who had a very good response to QBECO treatment after the 8 or 16-week treatment period they had in the last trial. And so Jim and I are exploring the possibility of initiating a clinical trial exactly for that purpose, for people who have joined one of our previous clinical trials, who had a good response to treatment, and after the trial was finished, are not in sustained remission, so would like to go back on QBECO treatment. In this 20-patient study and the 150-patient subsequent second stage of the study, we'll be treating for 52 weeks. We're hopeful, based on the nature of our treatment, that some patients may, after 52 weeks of treatment, may be able to be in sustained remission off of medications. But of course, that's something that has to be assessed, and one of the things that we're exploring. But it is our hope that we can initiate a clinical trial to accommodate people who had a good response to our treatment and would like to restart treatment once the trial is finished. Jim, did you have anything to add on to that?
No, I think so. And again, as developed, as Hal said, patients in this study will be treated for 52 weeks, so that gives us time to work out the details of any subsequent trials. So you can keep updated with that on the QIBD website. Next question is with regard to biologics. So if patients are actually on biologics, whether it be Remicade, Humira, Entyvio, can they come off that treatment for the 60 days and then be eligible, as long as they're, all other criteria for eligibility are met, can they enroll in the trial?
Yeah, and the answer is yes to that question. There has to be what's called a 60-day washout period, so that, as long as you've been off of those medications for 60 days, you can join the study. Another question is around the enrollment timeline. So the question was, is the timeline for enrollment strict, or can, once patients are actually approved and meet all of the criteria, can they have some time to enroll into the trial? In the 20-patient study, we're looking to recruit and complete recruitment in that study as quickly as we can. But we anticipate that we'll be continuing to enroll into the study at least until the end of June, and possibly into July and August as well. Jim, do you have any further words on that?
The only thing I would add to that, Hal, is because one of the important criteria for this study is evaluating the endoscopic or the colonoscopy endpoint, we do have a period of time where we said that once you've gotten the colonoscopy, you should be starting the study so that we're getting those results, those baseline results, as close to when you're starting treatment as possible so we can evaluate the treatment effect. So there is a bit of a timeline to enroll. That doesn't mean that if for whatever reason you can't enroll in the study right away, that you wouldn't be eligible at a little bit later time point. We just like to keep the evaluation criteria and the starting of the treatment as close together as possible.
What is the screening time frame?
30 days.
30 days.
Yeah.
So all of the screening and enrolling in the trial has to occur within a 30-day period.
So the next question is with regard to
for an individual.
For an individual participant, yes. So how does the treatment work in terms of visualizing symptoms for patients with Crohn's disease?
That's a very good question. We have had patients with fistulas who have been treated with QBECO and have had a good response. So we're hopeful that patients with fistulas will respond, but we haven't treated a large enough number of patients to make any definitive statement on that. But so far, so good in terms of response.
The next question is with regard to the QBECO SSI formulation or what's in the material. So in addition to the inactivated E. coli, what are the other ingredients in the formulation that's injected?
Well, the nice thing is that it contains only inactivated E. coli and normal saline. So in that sense, it's a very simple product, and in some ways, it's a natural health product because essentially it's bacteria and salt water. Our product used to have preservative. In our last study, we did have a preservative, but we've removed the preservative to make it as natural a product as we can. So in this coming study, the QBECO is just made from inactivated E. coli suspended in normal saline, which is salt water.
The next question is with regard to some of the eligibility criteria. So the question is colonoscopy evaluation the first step in the evaluation criteria, or do you look at clinical symptoms first to determine eligibility?
Because no one wants to have a colonoscopy if they don't have to have one, we look at clinical symptoms first, and if patients have sufficient clinical symptoms, then they have the colonoscopy. Jim, do you have any further words on that? Or?
No, I think that's it, and I think Hal had gone through some of the key enrollment criteria with regard to eligibility, with regard to abdominal pain and stool frequency, as well as we'll be evaluating the colonoscopy results to evaluate patients both prior to entering the trial as well as determining the treatment effect as patients are being treated throughout the study. There will be some other, blood samples that are collected just to make sure we have a good baseline for patients before they start the trial, but those are the main criteria to get into the study.
And we're just reviewing the other questions that have come through.
So one is actually just a comment with regard to the ingredients that are actually in the study treatment formulation, and that they are natural and that there actually are no preservatives in there. So that was just a comment from one of the participants.
And if anybody else would like to ask any questions, please do so.
So there's one additional question with regard to prior surgery. Can you participate in the trial if you've had prior colon surgery?
It depends on the extent of the surgery. You can have a resection as long as the resection isn't extensive. If you have had your entire colon removed and have an ostomy, then you wouldn't be eligible for the study. But if you've had, for example, a piece of your small bowel removed or a piece of your colon removed, you may still be eligible for the study.
Next, one question is with regard to when the site at McMaster and Hamilton will be up and running. And I think they're going through their ethics review process right now, so they should be up and running near the end of the month. If you are interested, what I would suggest is that you go into the QIBD.com website when the questionnaire is available, fill out the questionnaire, and we'll have somebody follow up with you even in advance of them being open, because we can start some of that discussion process in advance of that. So when the website is up and running, please complete the questionnaire and someone will follow up with you.
And there's a number of people from the Hamilton, Toronto area who I've spoken with already about their interest in the trial, and I'll be following up with them in the next 10 days by phone to let them know about the timing of the opening of the Hamilton site once we have greater clarity on it.
And the only other question is actually with regard to the MAP product that's basically undergoing clinical trials in the UK. The question is, have we been in contact with those people or anything you might know about that?
Well, I'm looking forward to connecting with the MAP researchers. It's an interesting hypothesis that a particular bacterial species, commonly referred to as MAP, appears to be more common in people with Crohn's disease. And it's been hypothesized that perhaps the MAP bacteria, at least in a portion of Crohn's patients, may be an important underlying factor in the disease. And so it's treated in that context by giving a vaccine that creates an adaptive immune response to clear the MAP bacteria. So that's different in a significant way from SSI treatment. SSI treatment is designed to restore innate immune function and clear a wide range of different bacterial pathogens, not just E. coli and MAP, but numerous other bacterial pathogens as well. Whereas the MAP vaccine is designed to create an adaptive immune response that is specific to the MAP bacteria. One of the questions with MAP vaccine, MAP vaccine, is that, well, it may address the infection with the MAP bacteria. It doesn't address the underlying innate immune system suppression that occurs with Crohn's disease. And it may be that MAP infection occurs in Crohn's disease because there is an innate immune system suppression. The immune system would normally quite easily clear MAP infection. So clearing MAP bacteria may not actually clear Crohn's disease, whereas we think with SSI treatment, because we're restoring innate immune function, then that once the innate immune system is cleared, is restored, it's capable of clearing a wide range of pathogens, including the MAP bacteria. But it would be interesting to look at the potential synergy between SSI treatment and the MAP vaccine.
The next question is with regard to someone who's enrolled in the study, and if the QBECO treatment is not working for them, if they're not responding, can they exit the study and go back on treatment, or is there a washout period for the QBECO before they can start their treatment again?
There isn't a washout period for QBECO. So if QBECO isn't working, of course, people can withdraw from the study at any time, and they can restart their treatment then at any time.
And I think that's all of the questions, Hal.
Hey, well, thanks everybody for your excellent questions, and thanks everybody for taking part and participating this evening. Very much appreciated. And thanks for your interest in Q and our novel approach to restoring innate immune function in Crohn's disease. As you know, current treatments for Crohn's disease suppress the adaptive immune system, which can have potential side effects and problems. We're treating the disease in a very different way by restoring innate immune function. And we're hoping that by treating the disease in this way, that we may potentially be able to create sustained remission off of medication, at least in a portion of patients with the disease. So thanks so much for your kind attention, and I'll turn things back over to Bonnie.
Well, thank you, everyone. Thanks so much for taking the time to join us for the Q Biologics webinar about our upcoming Crohn's disease clinical trial. We really appreciate all your great questions. You can always find more information on our website, QIBD.com. There will be a link to the recording posted for this webinar in a few days' time. So you can listen to it again if there's something you missed, or you can share it with people who you think may be interested. As we get closer to opening our first clinical trial site, as we mentioned before, you'll find the link to our pre-screening questionnaire, which will give you a better idea if you'll be eligible to take part in the trial. Follow us on social media, like us on Facebook, QIBD, follow us on Twitter, @QCrohn'sTrial. Thanks for joining us, and stay tuned for upcoming news and events.